Drinking coffee is generally considered safe for most people when consumed in moderation. However, there can be negative effects associated with excessive coffee consumption or for certain individuals. Here are some reasons why excessive coffee consumption can be considered bad. 1. Caffeine sensitivity. Some individuals are more sensitive to caffeine than others. Excessive caffeine intake can lead to symptoms like jitteriness, anxiety, rapid heartbeat, digestive discomfort, and even insomnia. It's essential to know your own tolerance for caffeine and adjust your coffee consumption accordingly. 2. Sleep disruption. Coffee is a stimulant, and consuming it too close to bedtime can interfere with sleep. Caffeine can stay in your system for several hours, so it's generally recommended to avoid coffee in the hours leading up to bedtime to ensure a good night's sleep. 3. Increased heart rate and blood pressure. Caffeine can temporarily raise heart rate and blood pressure. While this isn't a concern for most people in moderation, excessive consumption could potentially be problematic, especially for individuals with pre-existing heart conditions or hypertension. 4. Digestive issues. Coffee is acidic and can sometimes irritate the stomach lining, leading to acid reflux, heartburn, or stomach discomfort in sensitive individuals. It can also act as a laxative, potentially causing loose stools or diarrhea in some people. 5. Dependency and withdrawal. Regular coffee consumption can lead to caffeine dependence. If you suddenly stop consuming caffeine, you may experience withdrawal symptoms like headaches, fatigue, and irritability. This can be uncomfortable for some individuals. 6. Bone health. Some studies have suggested that excessive caffeine intake may lead to decreased calcium absorption, which could potentially impact bone health. However, the effect is generally considered minimal unless you consume very high amounts of caffeine. 7. Anxiety and mental health. High doses of caffeine can exacerbate symptoms of anxiety and contribute to feelings of restlessness or nervousness. Individuals with anxiety disorders may be more sensitive to these effects. 8. Pregnancy concerns. Pregnant individuals are often advised to limit their caffeine intake because excessive caffeine consumption during pregnancy has been associated with an increased risk of miscarriage and low birth weight. The recommended safe limit during pregnancy varies but is typically around 200 to 300 milligrams of caffeine per day. 9. Interference with medications. Coffee can interact with certain medications. It may enhance or reduce the effectiveness of some drugs. If you are taking medications, consult with your healthcare provider about any potential interactions with caffeine. It's important to emphasize that moderate coffee consumption, usually defined as 3 to 4 cups per day for most adults, is generally considered safe and even associated with some health benefits, such as improved alertness and cognitive function. However, individual tolerance varies, so it's crucial to pay attention to how coffee affects your body and adjust your consumption accordingly. If you have concerns about coffee consumption and its impact on your health, it's wise to consult with a healthcare professional for personalized guidance. Thanks for watching.